tell us about the role of GPs in the health system of both Australia and UK. I mean, we know the systems are considered one of the best in the world. But what is the role of GPs?
I love a statement about GPs. They say that GPs provide a cradle to a grave service. Okay. So right from the point a baby is born up until the point a person passes away, a GP is your advocate. A GP actually is your best friend in health. Okay. Now there's a lot of meaning to this statement, because what that means is that a general practitioner is the gatekeeper to the healthcare system, to the public healthcare system of the country. A public healthcare system relies on public funds. So you are answerable to every person in the country who is actually paying tax to fund that system. So if for return of investment, let's talk business here. For return of investment, it's important that the gatekeeper is solid, so that riffraff or things that don't need to be going to the secondary care health system doesn't go there, and it can be dealt with in the primary health setting. And that's where the GP's role comes, because he's the gatekeeper. He's the one who keeps the gates from opening up and flooding the public health system. Secondary, the GP is important because of the faith and the relationship that they build with a patient. When you go and see a specialist in a hospital, you might have a relationship with that specialist for a short duration of time. If you have a heart attack, you go see a cardiologist. Your heart attack treated, 3 stents put in, you don't see that cardiologist again. But if you have a good GP, you don't need to go and see that cardiologist, because you would have your primary prevention for the cardiovascular health straight up. Secondly, if you have had a heart attack, that GP will then hold your hand and lead you on the road to recovery. So the relationship with your patient is very important. And there is increasing evidence now that a personalized relationship with your doctor improves health outcomes overall.
Great. So when a patient or a person gets sick or ill, who does he or she approach first? In that sense, can you explain a bit more?
I'll talk about Australia, and I'll talk about the UK as well. Obviously, it's comparable Western health systems. So your first point of contact is your GP, okay? Because your GP will have your information at hand. They know exactly your background. They know exactly what medications you are taking. They know exactly what your family history is, okay? So they are the first point of contact. And you should have a regular relationship with your GP for optimal health outcomes. So yes, your GP is your first point of contact.
And is it necessary that you go to a GP? You cannot go to, if you want to see a specialist, how it work? Suppose you had some problem and think you should meet a specialist. How do you meet a specialist? UK or
Okay, the question is, how do you diagnose your problem? That's the first thing, okay? Let's say a person has a headache. Does he need to go and see a neurologist? The headache could be because of migraine, it could be because of stress, it could be because of depression, not sleeping. It could be because of hypertension, okay? It could be trigeminal neuralgia, There's so many causes to headache. So who is the one who will decide whether that person actually needs to go to a neurologist? Not the patient. The patient has a symptom. The patient doesn't know what the disease is. That's where a GP comes in, because a GP is great at detecting patterns of symptoms and telling the patient that you have this disease. If the patient has a disease, say they have, a neurological condition, it is the GP who decides that the patient goes to a neurologist. If they have a problem like, cervical spondylitis, for example, that gives you a headache, okay? You don't need to go and see a neurologist for that. You just need to go and see a physiotherapist.
But now we see in the age of information technology about India also, people check already symptoms on Google or ChatGPT. AI is coming up big way. So it's not that they're not informed. So they know what the problem is. Many times they want to talk and they diagnose by themselves also.
Yes, of course.
They're more knowledgeable about diseases.
100%.
There are tools to support knowledge. So let's change the value of GP in that sense, you know.
Not at all, because I think it complements the value of the GP. When a person reads something on the internet, let's face it, even if we are doctors, if we have an illness, we become patients ourselves and we get worried. Okay. So internet might tell you a lot of things, and the role of the GP is to interpret that information that the patient has. The patient might not have information that's necessarily true. Now, you're talking about AI. ChatGPT is open AI. Okay. So open AI can source material from anywhere in the internet. It could be Google, it could be someone putting some information on Wikipedia, right? So that might scare a patient. Okay. If the patient has a GP that they can relate to, they're comfortable with, they'll come and talk to the GP about it. And the GP will then be able to do the necessary investigations, which might not be as costly as what a specialist does. Make sense of the whole thing. And if they need to see a specialist, that's where they go and see a specialist. But 9 times out of 10, sometimes it might just be a very simple thing.
So in India, as we have graduated from the system itself, you get your licensing practice.
Yes.
Practicing license immediately after MBBS. How does it work in UK or Australia?
That's an interesting question. The reason for that is we are now talking about the rise of the generalist. Now, what is a generalist? In India, when I passed out, I did my MBBS and I went to the UK. My whole idea of a GP was you complete your MBBS, you go and work, in the community. You're a GP. You don't need to do anything else. And somehow it was seen as a second fiddle, okay, a second tier ranking of a doctor, someone who's inferior. Then I went to the UK. I remember calling up my dad and saying, I called him Daddy. I said, Papa, I came to the UK and I've seen that general practice is so different. Because it was a specialty. It was a specialty that was being taught in medical schools. It was being taught in the curriculum, and general practitioners used to train in family medicine. And they actually had a designated Royal College which used to hold postgraduate examinations. So to become a GP, in other words, you don't just finish your MBBS and become a GP. You do your MBBS where you train towards general practice. Then you go through a postgraduate training of 3 years where you spend about 12 months in hospital medicine, and then the rest in general practice settings. You complete your fellowship exams, which, by the way, quite tough. You do your theoretical skills, you do your practical skills, you do a workplace-based assessment, you face clinical competency assessments based on clinical evidence, then you pass out as a general practitioner and you're allowed to work as a GP.
So great. It was great talking to you, Dr. Sharma, and thank you for sparing your time for us. And I hope that this conversation, when it is disseminated, will be useful for public policy makers, ourselves, students, professionals.